What have I seen? Well, to be honest, what I have seen is really quite impressive.
I'm really reassured by what I've seen in terms of the principles underpinning the infrastructure for the new health roster medics, in terms of it being activity driven and not job plan driven. I think this is going to be revolutionary for our organisation.
The drive now is far more towards activity. Traditionally, we've been allocating staff out to a fixed pattern and saying predominantly where they were working, and then relied on a registrar or a senior member of the medical team to then allocate out the activities. That's taken up to a PA a week, a session a week from a senior doctor. From what we've just seen, it looks as though that's going to be far more automated against the predefined set of rules. So if that works, then it should save a significant amount of medical time.
I think that's a really big step forward. I know when we first started looking at it, and we were seeing our medical director was asking us to create all these reports about types of activity of work they do, and we were having to try and fudge these reports by putting it all in the location. And then when we had to create reports that had location information and types of activity, we were back to the drawing board. So it's definitely a step forward.
Particularly in areas such as anaesthetics and obs and gynae, the big areas where they sort of go across all across the trust. That's particularly useful for us.
So obviously, a couple of years ago, the WARE was a big leap within the software in terms of the fact that they use location-based rostering, and now we're taking an even bigger leap in terms of getting the what, in terms of being able to actually identify what the PA, what the activity rather is, and I think that really is just going to be an extra dimension and an extra advantage to us and the users of the system as well.